to you intrepid few who are joining us. We appreciate you. Thank you for being here. Welcome to this Inovalon Empower session, Preventing Harm to Achieve Harmony, Developing a Culture of Safety in Healthcare. I am Dr. Paige Kilian. I am Inovalon's Chief Medical Officer, and I am looking forward to an inspiring conversation here. I think we're all passionate on this topic, and I'm expecting this room to be full of passion. These are the people for whom this is the most important. I'm teasing. I won't call on anybody. I've heard those threats. In healthcare, safety is a priority, right? It has to be a priority, but not just a priority. It is, in fact, a promise that we make to everyone who walks through our doors, to patients, to professionals. Safety is the foundation on which we build our ability to deliver the care that we seek to deliver. It's how we protect our people. It's how we strengthen our teams. It's how we get the outcomes we're striving to achieve. We have panelists here today who have a lot of passion, as I mentioned, and their plan and my plan is to share some powerful real-world stories about how they have implemented safety initiatives in their environments, and we're going to hear some about the benefits they've seen, the strategies they've used, and how they've achieved buy-in among stakeholders. And at some point in this, I might share a little stakeholder buy-in story of my own. We'll see how it goes. But with that, I'd like to allow these panelists to introduce themselves. And if you're so inclined, if you have a particular point of passion you'd like to share around this topic as you introduce yourself, I would love to hear it. And I'll bet these folks would as well.
I'm Jade Fellows. I am the Director of Orientation for Prestige Healthcare Management Group. It's a skilled nursing facility group. A passion that I have, it was kind of funny when I got here on Sunday. I don't know if anybody did the t-shirts that they were pressing them back, but there was one that says, I'm in my empower era. And I was like, oh, this speaks to me because that is truthfully what I'm passionate about. So my career has been in education for a majority of it, and I'm really invested in providing resources and tools for our future healthcare heroes and empowering people in that way.
And I'm Kerrie Griffin. I am the Director of Clinical Risk for CHRISTUS Health. And I would have to say my passion, I got into leadership because I wanted to make sure the patient not only had a safe environment to be cared for, but that our clinical associates and our physicians had a safe environment to provide that care. And so it's not only about the patient, but I'm really focused on the staff members and the physicians, because early on in my nursing career, people would be making decisions that didn't come down to the front lines, didn't see what our physicians were going through, didn't see what the front line was going through, and they made decisions that negatively affected us. So that's why I thought I'll go back, get my degree, and start working towards that. So thank you for having me here.
Thanks for being here.
Yeah, thanks. Hi, good afternoon, everyone. I'm Matt Austin. I'm an associate professor at the Hopkins Armstrong Institute for Patient Safety and Quality. Through our conversations, I'll probably share a little bit more about myself and what I do professionally. But I think for me, what I really focus on is this idea of a culture of safety within healthcare institutions, and how do people feel psychologically safe to speak up when they see something of concern. And feel like that is rewarded and not punished. Because if we're really going to be a learning healthcare system, we really need to learn from both positive things and things where we have opportunities for improvement.
Absolutely. I love it.
Hi, I'm Chris Emerson. I am the Vice President of Clinical Quality Training, Oversight, and Innovation here at Inovalon. I work specifically on the Vigilance product line. Vigilance was a new acquisition of Inovalon back in February. And we have tools for pharmacy surveillance, infection prevention surveillance, and safety event reporting, among others. And so I'm really excited to be here to kind of give a little bit of a lens from the product side here at Inovalon. And my passion, I'm doing this work for the last 10 plus years, and I'm really passionate about creating tools that help improve clinician efficiency and make them better at their jobs and delivering alerts to them at the point where they can make an impact on patient care and improve outcomes.
Thank you all. Welcome. I think we're going to have an inspiring conversation. Kerrie, to your point, I think a lot of attention is paid, at least in the lay press and throughout the industry, on the importance of keeping patients safe. Obviously, it's important to keep patients safe, but I'm not sure as much attention is paid across the board to the importance, the critical importance of the well-being of the people who are delivering the care. So to that end, I would love to hear from some of you on the strategies that you've implemented in your organization to drive a culture of safety from both perspectives, from both the keeping the patient safe, but also focusing on the well-being of the professionals who are tasked with delivering the care. So with that, maybe we could start with Matt.
Sure. So, what I'll speak to, I think, more sort of broadly is, so I do a lot of work with an organization called the Leapfrog Group, which is a national organization that measures the quality and safety of hospitals and now ambulatory surgery centers as well. And I've actually been working with them for 17 years to help support their measurement and public reporting activities. And so, I think with that lens, what's been really interesting is I've gotten to hear and see what happens in a lot of healthcare facilities across the United States. And so, I think on the patient side, I think, where I think we seem to be moving toward is how do we utilize technology to better understand where there's patient safety events? How do we learn from those events? And in terms of worker safety, healthcare worker safety, I think there's been a big focus on sort of an overall sense of like well-being, right? So obviously there's issues with, things happening with like patients, exerting physical violence on healthcare workers, and I think that continues to be a concern too. But I think there's sort of the emotional side of, for healthcare workers, they're just feeling really burnt out these days. And so how do we look for strategies that help improve that, right? And so one of the things we're looking at the Armstrong Institute is how do we actually look towards de-implementation? So much of our quality improvement work has been asking healthcare workers to do one more thing. Can you do one more checklist? Can you do one more something? And in a time where people are feeling really like maxed out, I don't think we can keep asking people to do more things. So really, how do we think about quality improvement in a new way and with a new lens here in the sort of the near term and the future? So,
I love it. Kerrie, how about you? Do you have something you'd like to share about about your strategies?
Yeah, I think at CHRISTUS, we focus, it's leadership down. You have to have engagement from all the way at the top. Our CMO of CHRISTUS Enterprise is very focused on patient safety. He's a physician, getting his physicians that are all employed with CHRISTUS engaged in that safe environment. Our HR teams, our legal teams, our security teams, it really is taking a focus from a broad perspective, having that leadership down engagement with it. We also do managers, frontline managers that are in those leadership roles. We do education with them that errors that happen in a patient environment are human errors most of the time. And whenever something happens, take it from a human approach. And we teach managers not to go, oh my gosh, a mistake happened, and get upset at the person, because that does not foster an environment to have someone raise their hand and say, hey, I made a mistake. We want to comfort. We want to make sure and look at that process and the technology that broke in that process for that associate, and them to know that they're in a safe environment to say, hey, this didn't work. I made a mistake, or we caught this mistake before it reached the patient. Let's look at the process. So we do education with frontline managers on that, and then having that leadership, CMO, VP support is very instrumental.
Thank you. Jade, how about you?
Yeah, in my company, we're really trying to embed culture in general, including a culture of safety, right into that education process from day one. So we actually had a colleague who left our company because she was relocating to another state. And she sat through an orientation process that was 100% virtual. She calls up the CEO and she's like, you got to hear about this. This was amazing. And like a good company, we just copied that. Perfect. Yeah. And really turned it into something. But this has given us an opportunity to send that standardized message to each one of our staff members, regardless of what discipline they're working in. And we get that message to them on day one. We start building that culture, right? Because we all know changing culture is super difficult. So instilling that really early on into all of our employees, that this is the way that we do it, think that's been an important part of the process.
I love how you used the word embed, because I think that just like in any organization, not that it's not most important in healthcare, because it certainly is, but in any organization, you establish policies, right? And they become checklists. They become items that you have to get done. And the difference between something that's you're checking off on the list and not really focusing on, and something that really becomes incorporated, embedded into your culture is enormous. So I love that you used that word. Fantastic strategies. So you're implementing these this structure. What benefits do you see in your organization because of that? And I'd love to start back with you, if you don't mind, Jade.
Yeah, of course. So I think one of the biggest benefits, especially when we're talking about onboarding education, which is really my specialty, is retention. That's really what we're going for, is retaining the staff that we have. I think probably most people in this room, regardless of what you're working in, has understood that there's been a problem with healthcare workers and getting those people to join this force and retaining them in the force. We've been losing a lot of our senior leaders and the people who educate our new staff. So our strategy has really been to, use our generational knowledge that maybe not everybody in our company has, and kind of pass that on to everybody in this virtual environment. So that's a strategy that we've chosen, and it has been really beneficial to getting the information across, making sure that everybody understands. These people who are working this process every day, they understand the process, and that is a message that they have to receive from day one.
Absolutely it is. And the changing healthcare workforce, in fact, the shrinking healthcare workforce in many ways, is, I think, the biggest crisis that we're facing in this industry. It is absolutely horrifying to contemplate. I don't know how we're going to overcome it, but we're all working to get to that point. I really want to get to the point where we're talking about how you got buy-in. It sounds like you're doing a good job on your side. I'm hoping to get that from everyone. Before we move in that direction, I'd love to hear the benefits that you all have seen, Kerrie and Matt, in after you've instituted or begun to institute this culture of safety. What benefits have you seen in your health plan, in your healthcare space?
I know at CHRISTUS, with the data that we have, we're looking at the data and the projects that we've done. We've seen some great initiatives, fall reductions. We've seen our workplace violence data is going up, but it's because our associates have an avenue to report those situations and to share those situations, and it's giving them a safer environment to be able to have an outlet to discuss that, and it's promoting conversation with our security teams. So really building that collaboration, because on the ambulatory side, often gets left out, often gets forgot about. It's acute care focus, and so it's really getting that focus on ambulatory, that we do have unsafe environments and we do need that support.
It's fabulous that you talk about recognizing the increased reporting, not representing increased incidents. Do you think that your workforce appreciates that, or do you still have work to do to communicate to them that this is not increasing incidents, this is because we're recognizing it and fostering this environment?
They appreciate it. They appreciate the data, because we share the data frequently. They appreciate the data. They're like, okay, and they see the impact of taking that time to report the situation. They're seeing the impact of security on site, their leaders being more educated of how to handle those violent situations. And we're seeing, we do associate satisfaction surveys every 3 months, CHRISTUS does, and just little spot surveys, 15 questions. We're seeing improvement in those Glint surveys, it's a Glint survey, and seeing improvement with that they do feel safer in their environment, and they do feel that they have a voice and that their voice is heard.
That's fabulous. Matt, what benefits are you seeing so far?
So I'm going to maybe deflate the bubble a little bit.
Okay, that's fair.
Sorry.
No, that's fair.
I mean, I think progress has been slow in patient safety, and a lot slower than we'd like. And I'm not sure if we've hit on the magic formula yet. And I'm using yet because I'm optimistic.
I like it. There's optimism there. There's room.
I loved what Jade said about culture, and that culture is something that is acted on every day. I actually have a cousin who's a basketball coach, and one of her favorite sayings is, culture isn't built in a day, it's built every day. which I love because I think it's this idea of like, how do you continually sort of message that your safety as a healthcare worker is important and we're going to take care of you. And we also want to take care of our patients. And you know what, I know Southwest is undergoing a lot of transformation at the moment, but what I used to love about their culture is I think they really prioritize taking care of their employees, with sort of the mindset that if we take care of our employees, they can take care of our customers, right? And so I think it's, especially in a time where we have such turnover with healthcare workers, I think that's really challenging, but it would be great if we could sort of get back to a place where we really take care of our healthcare workers first so that they can take care of our patients.
And I feel like the tools that Inovalon and Vigilance are building really do try and promote a more efficient and effective workforce, which gives people a lot of pride in the work that they do, and it also helps improve patient safety outcomes. And you mentioned the shrinking workforce and burnout, and obviously those are huge problems, and they're big problems for the groups of individuals that use our products. Our infection preventionist workforce is an aging group of individuals. 40% of them will reach retirement age in the next decade. Pharmacies are reporting shortages. More than 60% of pharmacies are reporting shortages in pharmacists. I was on a continuing education call this past week, and this year for pharmacy school enrollment, they only have about 9,000 pharmacists enrolled, and they estimate they need more than 13,000 per year just to maintain the number of job openings. So how can we help bridge that gap to make our workforce more efficient? Because they're all being asked to do more with less. And so that's one of the things I love working on from a product perspective, is how can we deliver solutions that help improve efficiency. And we've had some great, and I think that promotes a culture of safety significantly. But there's been some great outcomes with some of our customers. HCA specifically did a longitudinal study over 6 years looking at pharmacist efficiency using our workflow. And they had a doubling in the number of interventions that pharmacists were making during that time frame. And they were also able to show a reduction in the amount of time that pharmacists were taking to respond to high priority alerts and intervene and make changes to patients' medication therapies, reduction in antibiotic utilization and improving de-escalation to more appropriate antibiotics, improving IV to PO conversions, all of these things, improving patient care, making the clinicians that use these tools feel empowered, that they're having an impact on patient care. It's really, it's special to see, and when I've joined customer calls, we had a business review with one of our longstanding customers just the other day, and we were wrapping up the call and thanking them for their wonderful partnership, and they said, we would be lost without Vigilance, and I would cry if they ever took it away from me. And like those stories really make me feel really great about the tools that we're delivering to our customers, because they really feel the power of them, and they do help improve patient care.
So you should absolutely feel excited, and it's great to hear how this individual or this organization felt about the Vigilance products. It's funny that you bring it up right at this moment, because I mentioned that I might share an anecdote, and now I'm going to, because you gave me a little bit of an entree. I want to move into how you get stakeholder buy-in, because I know it's not easy. Kerrie, I know you've got a good story to share. 6 months ago, not long after Vigilance became part of the Inovalon family, I was at a party, and I'm just chit-chatting, and somebody knew I was a doctor and somebody over there is a nurse, and so they introduced us, and this individual, I think, Haley, I might have told you this story, this individual happened to be a nurse in charge of infection control of a hospital in Delaware. And I was like, oh! Yeah, and so I was all excited and started telling her about the Vigilance products, and her face collapsed. And she backed up and she said, why would I want to bring something in that's going to eliminate my job? It's like, no, not at all. But immediately, it had not occurred to me that there would be resistance in accepting something that would be so helpful to achieve safety, both for patients, obviously, and for staff. So I was shocked. I'm like, okay, I need to learn more. I need to reframe and understand this. I came back and shared my story with Haley. But with that in mind, What have you seen in challenges achieving buy-in from stakeholders, and what have you done to achieve that buy-in? I'll start with you, Kerrie.
We were getting, whenever I first went to CHRISTUS, the ambulatory side didn't have a way to report risk events. So quickly got a paper together, started reporting on paper, and then went to a different, more cumbersome system, but people just wouldn't report. We weren't knowing about our problems, which kept me up at night. If you don't know where your problems are, it leaves you very open to liability and our safe environments for our patients. So Vigilance was introduced with CHRISTUS, and we rolled it out in end of March 2021. Prior to that, we had done anonymous patient safety survey with our associates and our physicians. We've done it 2019, 2022, and 2024. We just did our recent one. That combined with the data in Vigilance has really helped us show our staff the importance of capturing these events. It is a change in culture because no one inherently wants to raise their hand and say, I made a mistake or I nearly made a mistake. A lot of pushback that we got initially was, why do we need to report that? I'll just take care of it. You don't need to know about it. So then we took it a step further. Your line of sight is your space that you're in every day. My line of sight, and what I had to teach people, my line of sight is 3 states worth of places. So if you think it's only a problem at your spot, you report it. Let us know about it, because then they may be reporting and they may be reporting, and we have a larger problem. Now people we've had to add to our team because of how much communication and how much buy-in we've gotten from it. We developed a Just Culture program from this, where we go out and we look at the data, we look at our problem areas, and we go visit with these locations. We take an hour with the staff. We use case studies. We pull them situations straight out of Vigilance. We de-identify them, of course. They don't know where it happened or the patient specifics, but we tell the story. This happened in a clinic just like your space, and it opens some eyes. It really has that light bulb approach. Then we spend about 10-15 minutes talking about the importance. Then we move into a gallery walk where we put 4 questions up on the wall, and we have them walk around of, why haven't you reported? What keeps you fearful of reporting or having that conversation with your clinician or your coworker to say, hey, is that really the right step that we're supposed to take? What keeps you from talking to your leaders about problems? And then what would you do to make your clinic safer? We let them have about 10 minutes. Then we do facilitated discussion around that. And we've done this at over 100 of our locations and gotten really good buy-in. No leaders are in the room while we do it, just myself and a couple of members of my team with the staff, frontline staff. Then we debrief with the leadership, and that really brings in that buy-in. And, we need to do this. And it helps them see their space in a different environment, which has been very productive. Since rolling out Vigilance, one thing that it's really cool to sit back and look at the numbers, we've increased our reporting by 122% in the ambulatory division. We've also developed a near-miss award, and I remember having a physician call me and argue with me why.
I don't believe you.
I know. Exactly. It was. And she, and CHRISTUS is a Catholic healthcare organization, and this one physician is also a nun. And she called me and she calls often, but it's those 5 a.m. calls, but I was like, what did you do wrong now? I was like, I don't know. But she called, she said, why are you celebrating a mistake? Why are you celebrating a near miss? Because we started once a quarter. We look at all of our near misses and we pick the top 2 that we can learn from. And we share them at every venue we have with meetings, de-identified. And we talk about the high reliable principle that person applied to that situation. And our system has kudo points, which people can turn into monetary things and buy things with. So they get 2,000 kudo points. And it's a big celebration. We've been doing it for 3 years now. But I remember initially it was like, why would you celebrate a mistake? And it's like, it's not celebrating a mistake, it's celebrating the courage to raise your hand and feeling safe enough to say, hey, we've got a problem, we need to stop and look at this. So very proud of that.
You should be. You are building trust. You are building transparency, fostering transparency. That is phenomenal.
And now that one physician does report events, even messaged me the other night. She goes, I told her, I said, I use your story. And she goes, oh, that reminds me, I got to report another event. Has she
gotten some kudo points now? She likes those.
Twice.
Oh, that's great.
She has won twice.
You got the buy-in.
I feel like the doc's getting redeemed a little bit, at least.
Yeah.
Isn't it?
They did, and our physicians are now reporting, and they're like, where can I report that? So increasing that physician engagement too.
That's phenomenal. Matt, how about you?
I mean, there's just so much of what I want to unpack.
I could tell you wanted to talk.
Right? Like,
You want to come over here?
like what my favorite thing to be that I've been like saying over the last like month. To me, a culture of safety is a culture of learning. Right? It's how do you feel like you can speak up and we're going to learn from those events as opposed to people being punished for those, right? And so what I love about actually this idea of moving towards technology to actually report events is it takes away some of the fear, the mistrust, all that goes into, right? So the story I would tell is my partner recently became a nurse. He's on an oncology unit at a hospital in Baltimore, not Johns Hopkins, and actually had a medication error and reported it through their event reporting system. And basically, when he came in for his next shift, he got a 30-minute lecture from the nurse educator about what he did wrong, what he needs to do different. Like, it was not seen as an opportunity for learning. He felt like it was an opportunity for me to be punished. So when there was another event, not a medication error, but another event, he's like, I'm not reporting it. I'm like, you got to report it. He's like, no. He's like, I don't want to have a 30-minute lecture again about what I did wrong. So this idea of sort of taking the human being out of the reporting, to me, actually has some great benefits. And so in the work I do with the Leapfrog group, we are exploring asking hospitals to adopt technologies that use trigger tools to scan the electronic health record to improve the reporting of these patient safety events. And so that feels to me like a great opportunity to, not that you shouldn't have a culture of safety where people feel like they can speak up and share and learn, but to me the technology would be a way to sort of improve the reporting with all the humanness that comes with mistrust and fear and all that stuff. So, anyway.
And we're going to talk about technology for sure. Jade, do you have anything to add on how you all have overcome barriers in achieving buy-in by your stakeholders, or has that been a smoother process for you?
There's definitely been hurdles too, and I kind of hear what everybody's saying here, but it's just that day-to-day process, and it's just got to be built and baked into everything that we do. But no, I agree with everybody. Yeah.
Let's talk about technology.
All right.
Because it does seem like that technology or not having technology can make a big difference in this space, and Matt's started to get us there. Chris, do you have anything to add in this space?
That really gave me a nice entree.
Yes, he did.
And Kerrie essentially answered a lot of it as well. But obviously, technology, we feel, can play a huge role in improving patient safety and creating a culture of safety. I think a lot about safety event reporting in this particular question as well, and how can we use technology to automatically detect when safety events happen. And we have technology that does that. We leverage rule-based AI to write rules that will detect when particular safety incidents occur, and they will automatically create safety events in our safety event reporting application, totally taking the voluntary reporting out of the person taking the initiative to go in and voluntarily report things out of the equation. And Kerrie's organization is actually using this on the acute care side for detection of adverse drug reactions. They gave us 20 different scenarios that they wanted us to use these electronic triggers for, and it resulted in a 400% increase in their ADR reporting over voluntary reporting alone. And they've been running these since 2022 now, and those numbers have held steady. Like the technology is really increasing the event reporting dramatically in that particular category. And then obviously that created a lot of excitement with our other customers, and we have another large organization which has rolled out 10 different scenarios for specifically in the medication error space. And they've only been running them for a couple of months and are already seeing a 35% increase in medication error reporting over voluntary reporting alone. And so again, really taking that individual and all of those reasons why people might not report an event out of the equation, and giving an organization that a more complete picture of the risk and what's going on. Those things that keep you up at night, if you don't know what's going on in your organization, it's really hard to implement changes and drive improvements in patient care. And so I feel like the technology can really play a role here, and we can leverage things like electronic triggers to really drive that forward.
Absolutely. Anybody have anything to add on the technology as a key component here? I know you all touched on it a bit. Anybody want to add anything?
Well, I was curious about what you were just saying. So does this identify the individual who had that near miss or who had that mistake?
It identifies the patient where that particular thing occurred.
Yeah.
So an example could be a patient received too many opioids and they had to be reversed with naloxone. And so we have the temporal relationship between a medication is given and then the patient receives a reversal agent. And we can build other filters into the rules as well. So like a lot of these rules will exclude patients during the first 24 hours of admission, because the assumption would be that maybe they came in with that particular situation, and it's not because there was actually an error, but because they presented to the hospital with that problem. And so there's ways of really making those the rules very specific to identify things that actually pan out to be categorized as safety events. And the CHRISTUS in particular, 75% of the auto-detected events were ultimately categorized as safety events. There are ways to categorize things after they're reported as not safety incidents, but 75% of the ones that the rule engine detected were categorized, investigated fully, and closed out as actual events with a level of harm assigned.
Yeah, that's really intriguing. We're utilizing technology just to kind of streamline our processes with hopes to dedicate more time to fostering that culture and to, working on staff development and stuff like that, but that process seems really intriguing.
Yeah.
It's exciting.
Yeah.
Anybody else have a comment on technology before we shift a little bit? All right, so lots of passion around safety here, which is fabulous. You run up against operational pressures, right? So like in any industry, you've got production pressure and you've got quality pressure, and they're not always pushing in the same direction. How do you balance operational execution pressures with establishing, maintaining, driving your culture of safety? Kerrie, do you care to comment first?
Sure. I think we have to be intentional. You have to continually be intentional about your approach and sensitivity to operations, and that's a high reliability principle as well, of being sensitive to that operations need, but also the focus remaining on patient safety and staff safety in the environment. We're constantly reevaluating. We developed our Just Culture program, rolled it out in 2022. We're now reevaluating that. And how can we make it better? We're noticing that we need to be intentional about implementing. We tell folks that they need to report. We tell folks what to look for. But how do they apply it to their daily life in their care environment? So we're now going to be focusing on, we've realized that, and revamping and looking at what we've done, how do we make it better? Focusing on teaching folks how to implement it, not just here's what you need to do. We had a very scary event recently, and we asked, doing our root cause analysis, and asked the associate, well, do you have this tool and this tool? Well, yeah. Well, what do you do with it? I don't know. They told me to put it on my badge. Okay. Taught us, hey, don't just teach them put it on their badge. Teach them what they're using it for, how to apply it. So that's going to be our focus, and I think that's where you constantly have to stay intentional about your approach.
Absolutely, moving from checking a box to embedding it.
It is, that embedding that culture.
Mm-hmm. Got it, Matt?
Yeah, I mean, so I report to the Senior Vice President of Quality and Safety for Johns Hopkins Medicine, and so one reflection is he and I were having a conversation about a month ago, talking about how the organization could do a better job of leading with quality, right? That we still are in a place where leadership has primary conversations about finances. But he was pointing out that, the organizations that have sort of created goodwill among Americans and maybe outside of our borders as well are really organizations that have led with quality, right? And that people flock to them, people come to them. And so I think there is an opportunity to sort of rethink how do we lead with quality as opposed to how do we lead with money. So that was one sort of reflection. The other reflection was, in some ways, the government, other organizations like the Leapfrog Group, I think have helped organizations try to prioritize safety, right? They've attached money, the government, to pay for performance, value-based purchasing. So there is a financial incentive to improve your safety performance. So I think that helps reinforce that. And then, like Leapfrog puts out hospital safety grades, and so at least in many organizations, there's a focus on why didn't we get an A? So hopefully that sort of prompts organizations to refocus that on as well. But I mean, it's tough, right? There's a lot of, this is a challenging healthcare environment. Revenues are tight, hard to attract healthcare workers. How do we keep sort of quality and safety, especially as we're coming out of a pandemic? How do we sort of reset all of this a little bit? So it's tough.
Absolutely. Jade, do you have any thoughts?
Yeah, to your point, I feel like the gratification you get from developing culture safety isn't that instant gratification that you might get with some other initiatives that you're working on, but it ultimately is. These do reflect on the adverse events, those quality measures, our falls or fractures. If we have a systematic problem in our center, but we're just assigning blame to the staff member who maybe transferred somebody incorrectly or did something incorrectly because there's a system failure, we're not addressing our problems, and those ultimately do reflect on our QMs and our reimbursement and everything. Sure. So, yeah, that resonates with me.
We are going to move to Q&A unless anyone has does anyone have a comment that they didn't get to share? With that, does anybody have a question? And I will not push because I know we don't have many folks in the room, but we would be delighted to hear your thoughts or your questions if you have any. Did you have a comment?
I was going to ask a question of the audience.
Oh, that's a great idea.
Well, I just didn't know if anyone comes from an organization where you'd want to share some of your successes with culture of safety. That's fine if you don't.
We're working on it. So
there's a hand.
Sorry, there's a hand.
Share a struggle as far as
Okay.
moving, towards more AI and data-driven, combating the disconnect with relationships and building that culture. We're coming out of COVID. We're it's like this all the time. How do we make sure that we don't lose that connectivity when we are driving this forward with the shortage of staffing as well?
It's really tough. I mean, healthcare providers spend a lot of their time in front of a screen by themselves, right? And how do you create a culture where everyone's...
It absolutely is tough. I think, and I hope you all agree, that this has been an inspiring conversation. I think the message is that it takes intention, it takes collaboration, it takes technology, it takes recognizing that we have to move beyond checking a box or writing a policy to incorporating this into our culture as a whole, to making it the foundation on which we do the work that we do. But the ultimate message, I think, is it's worth it. It's worth it. So thank you all for being here today, and thank you all for a really terrific conversation. I appreciate it.